In this video, I'm going to share what it means to have good mobility, being flexible or supple. There are four major components of having good mobility throughout your system. So when you design or your mobility program, you want to consider these major factors. So first one, and let's look at some of the external ones first, or the more obvious ones first. So the first one is good mobility at the joint. So you want to have good joint range of motion, good mobility at that joint capsule. So for example, if it's my elbow, I need to have good mobility at that elbow joint, okay, whether for flexion, bending, or extension. And for that matter, for rotational movements and side bending movements too. So that's the first component you have to restore first. So joint mobilization techniques or other stretching techniques to improve the joint's mobility. So you have full range of motion in that joint so that specific joint can function properly. Okay. So the second part is thinking about the flexibility or mobility of the length of the local muscles and tendons and tissues around that joint. So for example, does my bicep muscle have, or the bicep tendon have good range of motion or good mobility? Or is it too tight or shortened? It's not long enough. So it's going to restrict my ability to extend my elbow completely, right, if the muscle is shortened. So the length of that muscle, so having adequate mobility. The actual tissue glide in between layers of tissues, or there are adhesions, or there's a thickening, there's scar tissue, or things that are just bound up, whether it's the myofascia, the actual muscle, the tendon, any of those structures, soft tissue structures are bound. It's not going to allow for proper mobility of that specific muscle or that tendon, right? So you have to make sure, in addition to the lengthening, stretching, for example, or mobility exercises, you have to make sure that there are no restrictions. The layers of tissues are gliding properly. So if they're gliding properly, if there's good glide in between layers of tissues, there's good movement there, you'll be able to lengthen or move properly. Right? So that's your third component you want to consider. You're looking at the joint, you're looking at the length of that muscle or tendon or that whole or that unit, restrictions between layers of tissues. Okay, so that's your third component. From the holistic medicine standpoint, is the proper flow of chi, prana, or energy, as well as circulation. Okay, so if the shrotas or channels, fine channels that are open and moving properly, there's going to be proper movement of energy as well as circulation in a particular region, and there will not be blockages. So there are blockages in those channels, and various organs that are affected by those channels or are related to those channels is going to also cause poor functioning, or for that matter, restrictions or lack of mobility in certain joints or tissues. Okay, so this is a different perspective you have to consider. It's the internal perspective, internal functioning of the various systems. This is how you want to think about mobility, and when you're trying to work on a program, a flexibility or a joint mobilization or a massage or various things you're incorporating into your program to improve the mobility of a tissue. Share the video if you think it can help somebody else. And we got our program coming out. It's almost there. It's launching very soon. And if you're interested, make sure you go to the site and you sign up for it. Subscribe to the channel. And if you have any questions, leave a comment.